February is American Heart Month, a time to focus on things like heart disease and high blood pressure. Now, you've probably heard of hypertension, which is another word for high blood pressure. But what causes it, how can it be prevented, and what are treatment options? Turns out there's a new treatment option that we are going to talk about today, and our sponsor, the Detroit Medical Center, is home to the specialists who can provide care for your heart. And joining us to share his expertise is Dr. Dallaire Gardy, an interventional cardiologist at the DMC. Dr. Gardy, thank you so much for being with us.
Good morning, Tati, and thank you for having me again.
It is our pleasure. So we always learn so much from you, so let's get into it. So when our doctor tells us that we have high blood pressure, what exactly is going on in our body?
This means is that when there's so much pressure on the arteries of your heart or your body, that more it can tolerate or take. That shouldn't be the case, because your blood pressure as an average should be anywhere from 130/80 or less. Now remember, when we get older, these arteries are more stiff. So we allow your blood pressure to be higher, but as a general rule of thumb, 130/80, that's what should be your blood pressure.
So if I were to be having high blood pressure, are there some physical symptoms that I would experience?
You know, Tati, I'm glad you asked me this. Problem, a lot of people, they don't know that the high blood pressure is asymptomatic. That's why we call it silent killer. So you have to pay attention to your symptoms. And if you have symptoms, either it's going to be blurred vision, or you might have some headache, sometime imbalanced gait, or even chest pain or pressure. If you ever feel these symptoms, it's kind of late in the game, and you should call your doctor right away.
Okay. So if you're diagnosed with high blood pressure, then what should you be doing to help lower it or even prevent it?
There are multiple ways. Number one, let's talk about what we do in our lives. Talk about exercise. Number one, exercise is very important for us to do. That will lower your weight, which is another important factor in the blood pressure. With that means you're going to eat healthier, which means you stay away from salt. Remember, no cigarettes, because cigarettes is a killer and stiffen your blood arteries, cause stroke, cause higher blood pressure. You want to stay away from this. And one important thing, less alcohol. If you can stay away from alcohol, that'll be great.
Yeah, okay. So now for patients with high blood pressure, what are the treatment options that are available?
So we can go both, like either ways. Number one, or both, let me say, put it that way. Number one, your lifestyle. What I mean by lifestyle is your first is to exercise and try to do meditation. Stress is a very important factor in our life. And I'm one of the people who like the yoga. You go to yoga, you exercise, you sweat, blood pressure drop, your weight drop, and then mentally you feel better. So that's one way. Of course, no sodium, you lose weight, eat healthy, exercise, very important, as much as you can. The other aspect to it is medications. There are so many types of medication. If we can divide them into groups, one of them is the beta blocker or calcium channel blocker, diuretic out there too, between others. Each one of them have their own side effect, and they're good. Calcium channel blocker dilate your blood vessels, make the blood pressure less, but it's going to give you leg edema, swelling. Beta blocker decrease your heart rate, cardioprotective. It's excellent, but at the same time, it might make you feel tired, fatigue. Men don't like it because it has sexual side effect. The last thing is a diuretic, make you go to the bathroom a lot. It's a good blood pressure medication. Having said that, we're coming to our new exciting news about the new treatment out there. So now we're going to be offering in Detroit Medical Center the state-of-art technology that's coming out. This has been worked on for years. We're trying to find a cure or something which is make our blood pressure less and less medication. I cannot say it's a cure, but it's called renal denervation, which means you go in with this minimally invasive procedure. It's in and out the same day. It's little poke under moderate sedation. We go in with the catheter into the renal arteries. We do radio frequency ablation to kill these hyperactive nerves. So guess what? Your brain won't get excited anymore. So your blood pressure will start to drop, and you're going to get rid of a lot of these blood pressure medication, maybe enough to drop them. What comes with it?
State of the art.
Yeah.
State of the
Cost
art.
less, less side effect, and happy, free of medications. So we're looking forward to serve our community in Detroit.
Most definitely.
Yeah.
Listen, there's always something new coming out. And thank you, Dr. Gardy, for sharing this with us. This is great information. Everybody is looking for the new treatment option, ways to get off their medication, and this might be it. This might be it.
As I
Right.
said, remember, it's not a cure. But hey, if we're gonna get rid of a lot of this medication, make you healthier, why not?
Why not?
We're all excited, looking forward to it.
That's true. Dr. Gardy, thank you
Thank
so
you.
much.
Thank you again.
I know you can take a free online heart risk assessment to better understand your heart health. Go to the DMC website at dmc.org/hearthealth. Again, that's dmc.org/hearthealth.